It's an honor for me to take a few minutes out of my schedule tonight to say a few things about a critical partnership that we at Intermountain have with Securonix, with Sachin and his team, and I'll share a few of those things with you. First, if you don't know a little bit about Intermountain, we're an integrated delivery healthcare system. We have hospitals, 22 hospitals, hundreds of clinics, home cares. We employ physicians, and we also have an insurance plan. So a large system. We're involved in all of the healthcare issues, the privacy law that Sachin referenced, the security law. We're involved in Sarbanes-Oxley, payment card industry. All those things are concerns to us. And I think a thing that is significant, if you just saw the Verizon report, that came out, it indicates that healthcare is number one this year on their list, and we've recognized that, we feel it, we sense it, and we notice the number of attacks that are occurring inside our environment. And it has to do with the value of that patient record that is at risk. And so we're working very hard and spending lots of money to understand user analytics, behavior analytics, geographic, privileged account management, all those things that are a part of the Securonix platform that have been helping us as we go into this environment. Today, the attacks, the risks are significant. I list a few things up here that we have shared with our board and our management committee, the significant things that have occurred, the phishing attacks. And if you wonder in healthcare why these things are occurring, it's largely due to targeted attacks that are hitting our healthcare industry in an attempt to get access to those records. And unfortunately, our people are responding very readily to those phishing attacks. I have a sign in my office that says, "Shut down mail." It would help us in the healthcare industry. It could stop that. Unfortunately, the CEO won't let me, but that is a significant issue. We have a number of things that are trying to subvert those attacks and shut those down. But I think, and I won't go through all of these, but critical to us, the medical devices. And if you considered we're a company of 40,000 employees, 105,000 people who have identities that we're trying to protect, and all of those devices, those endpoints, those mail accounts, pale by comparison to the hundreds and thousands of medical devices that it takes to run a hospital and keep patients and the physicians with the information they need. And so those attacks are very significant for us, as something like WannaCry or NotPetya or Spectre comes out. You have to fix the endpoints, the servers. We have to fix those, plus over 20 times that number of medical devices that have those same types of hardware and those same operating systems. And those are devices that are very difficult for us. At Intermountain, we have made a choice to move to the cloud because of the cost efficiencies that it provides back to our members and our patients. What that means is our medical record is in the cloud, our ERP system is in the cloud, our office solutions, much of, if not all of our imaging occurs in the cloud. And many of the resolutions of patient information are done through the cloud. So that puts in, for us, significant effort around how do we keep that all secure. At Intermountain, we run a 24/7 security operations center. And at the heart of the things we're doing, the identity is key to us, and understanding where is that identity being used. Is this a member, a patient, a physician? Is it a physician who today is a patient? Is it a member who is today a patient? Or is it a member who today is an employee? So we have all of that information stored. We understand it. We use the Securonix platform to do large amounts of analytics. In our security operations system, we're collecting 6 to 8 billion log files per week, and that processing doesn't happen well in first-gen SIM. So we're using the analytics, the tools that have been provided, and doing AI to understand controls. We have spent quite a bit of time taking physical and technical controls prescribed by Washington, by government, through HIPAA and high-tech legislation, and we've put those into artificial intelligence using logs to try to enforce the physical technical controls that we find are necessary. And I won't go through all of this, but we're really migrating as many of the controls as we can into artificial intelligence and using analytics to understand, are our people in the right place, with the right role, in the right geolocation, in the right physical hospital for the access that's being provided. And with that, then we can detect and see when anomalous behavior occurs. Using AI, most of the events that occur in our environment don't become incidents because we can eliminate those using products to compare against a role, to compare against an account, to compare against a geolocation. So those are things that we're spending quite a bit of time on, and we appreciate the information that we get from the Securonix and the Sevion products.